Well, hello and welcome to today's 30 Minutes Facebook Live Ask the Experts program, where we will be discussing ovarian cancer and neuropathy. My name is Jennifer McClendon, and I am the Education and Mission Program Senior Manager here at NOCC. And we are delighted to have Dr. Martone with us today discussing the topic of neuropathy, a side effect that many of us, I'm sure, have encountered. So we are in a new year, 2022. And if you haven't joined us for a Facebook Live Ask the Experts before, these 30-minute Facebook Live sessions are designed to provide you with timely and relevant ovarian cancer information, tools, and resources. And we focus on a variety of topics for a variety of audiences, whether it be awareness and risk information for the general public at large, or we dive into specific treatment and management updates for survivors. So we hope that you find this series is a helpful tool as you enhance your discussions with your healthcare providers as well. So today's discussion is going to specifically focus on neuropathy, a possible side effect of treatment. And we want to provide you with information about this so that you can be informed and have better discussions with your own doctor and have the best quality of life as possible. If you have any questions for Dr. Martone today, please feel free to type those into the feed below. We will be addressing those at the end of the program. And we will not be addressing any specific advice questions. We will need to keep those pretty general, but feel free to type those in at any time. And also we will post a survey towards the end so that we hope that you fill that out for us. But welcome Dr. Martone. He specializes in cancer rehabilitation medicine, where he works to enhance a person's quality of life and function, which is often impacted, as we know, by cancer and its treatments. And he commonly helps individuals with conditions such as neuropathy, numbness and tingling, fatigue, among many other things. And he is passionate about integrative medicine and uses acupuncture and osteopathic manipulation to improve a person's function and symptoms. So he has a great deal of expertise. We are delighted to have you, Dr. Martone. Welcome with us today. You're welcome. So as normal, we will just get started into our questions for this session. So just to start off, the first question is, can you tell us a little bit about what neuropathy is and maybe describe some of the symptoms that someone might notice when they encounter neuropathy?
Sure. So neuropathy, essentially, it's damage to your nervous system. And so that can take effect in many forms. So typically when we talk about neuropathy, we break it into two major categories. So one is sensory, feeling like, do we have any changes in our sensation? Or did we have a change in our feeling? Are we having increased pain? And then the other is function. We look at, are we having any actual motor weakness? Is it affecting our motor function, our muscle strength? And so that's how neuropathy can present, either with that sensory or that motor component or with both. And typically common symptoms that people might experience are things like numbness and tingling, an altered sensation, possibly weakness, balance problems, and sometimes just that feeling of, a lot of times patients will tell me, I feel like I'm walking on gravel, that altered sensation.
I did not realize that motor function until I was researching it a little bit more was also a symptom of neuropathy. So things that you mentioned, what, like balance?
It can. Well, so balance can be affected by your sensory input because we do need to feel how we're walking on the ground. We get actually a lot of feedback from what we're feeling. Motor function it's typically less common, especially in chemotherapy-induced neuropathy, to have motor impact, but it can happen.
Good point. Yeah, it was just something that was a revelation to me. Yeah. So as we all know, we find ourselves in winter, the middle of winter right now. And I also read that during this time of year, sometimes this time of year can be a little extra challenging with the cold weather. What can you kind of maybe talk to that a little bit and maybe what someone can do?
Certainly, yeah. So it's not uncommon for me to hear that as well. And that's because cold can really kind of exacerbate a lot of these symptoms that people might be experiencing. And so, simple things, there's lots of simple things as we kind of talk about this that we can do to help improve those symptoms. So things like actually making sure you're wearing gloves or wearing stockings on your feet can actually be very helpful. One, keeping the warmth is helpful to prevent those symptoms. And then two, actually, when you're wearing tight things like that, like stockings, it actually can help to do what we call desensitize the area. So it actually is altering the input that's coming in. And that sometimes can be helpful, especially if you're having painful symptoms. Other things that sometimes I recommend, especially in the winter, are pepper-based creams that can be helpful to help even like warm the area. Things like capsaicin cream, which is actually based off of a pepper plant. And so it's kind of a natural thing, but it can help to actually warm and alter that sensation that can help with neuropathy symptoms.
Pepper-based creams. I have not heard of it.
So a very simple one, common over-the-counter capsaicin cream. Sometimes it's definitely worth a try.
And so that can just kind of provide a more warming sensation.
You can provide a warming sensation. And again,
Okay.
it's altering that input there. So maybe it's not as painful. You're just feeling the warmth.
Okay. Very good to know. Very good to know. Thank you for that. So in general, who would we consider maybe more at risk for neuropathy? Are there people that are more at risk than others?
Sure. So there are some risk factors. So if you have pre-existing nerve damage, that may make you more susceptible when you're going through chemotherapy to have neuropathy symptoms. So things like having uncontrolled diabetes can affect your peripheral nervous system. Increasing age can also be a potential risk factor as well. And then anyone who has an underlying vitamin deficiency could also be at an increased risk.
A vitamin deficiency, any vitamin or a specific vitamin?
So specifically B12 and folate.
Okay.
And typically before you undergo any of this treatment, your oncology team will be doing routine lab work, which typically see alterations in that. So those are people who might be at increased risk.
Okay, that's awesome. That's very helpful to know. Good to know. And so for those that do have neuropathy or have presented with symptoms of neuropathy, how often, or I guess my question is, how is it usually diagnosed? And then from there, how is it usually treated and managed?
Yeah, so specifically someone who is presenting after chemotherapy or during chemotherapy with neuropathy symptoms, it's typically a clinical diagnosis, meaning, we have your history that's making sense, your history, your symptoms, and your physical exam are making sense. So that's what we call a clinical diagnosis, where, based upon your evaluation with your physician, it looks like this is, chemotherapy-related neuropathy. If we did need further testing, there is actually a nerve conduction study or test called an EMG. And that's actually a test that can see how your nerves are actually firing. We typically would reserve those for patients, one, if this isn't actually fitting that classic picture of chemotherapy neuropathy, we're actually not sure about the diagnosis, or if you're having more of an extreme case, like those who are having those motor problems, that weakness, that'd be something that we would typically want to further investigate and actually see how are your nerves firing.
Great. So that's helpful to know how it might come about as a diagnosis. So how do we usually treat or manage neuropathy?
Yeah, so there's definitely lots of ways to go about managing and treating. And really the first thing you have to do when you're deciding what kind of treatment you may want is you have to really break it down into a couple categories. So one is the pain aspect. Are you having any pain? Are you having discomfort related to this? A lot of times I will have patients tell me, I'm having numbness and tingling, I'm not having pain. So there's a big distinction that you want to make about that. If you're actually having pain, then that's typically something that we would treat with multiple modalities that I'll kind of go into. The other thing that we want to look at is how is this affecting your function? So even if you're not having any pain, you may be just having some numbness, tingling. Are you having balance problems? Are you having difficulty with doing things using your hands? Are you having difficulty with like buttoning buttons, things of that nature? So we really want to break it down into how are you feeling and how is your function?
Feeling and function. I like that. And to really make that distinction between pain versus numbness or tingling.
Right. And now numbness and tingling can also be discomforting.
Yes.
So we don't, ignore that either. It's just really important to understand, what is your comfort level right now? Do we need to do something to be making you more comfortable?
Got it. Got it. Thank you. And when we're talking about treating neuropathy, for those that are watching, is there a certain specialist or a certain physician that would treat neuropathy, or is that your general, healthcare provider, oncologist?
So yeah, so lots of people can definitely help you and treat these symptoms of neuropathy. So I am what's called a physiatrist. So I'm a physical medicine rehabilitation doctor. So rehabilitation professionals can be very helpful for these neuropathy symptoms, especially if you need things like certain types of therapies. Your primary care physicians can certainly be a good resource, and then neurologists, and especially for extreme cases, having a neurologist evaluate you is always a good idea. I think to even talk a little bit more about treatment, if you don't mind us going back.
Absolutely.
So when we talk about treatment, so I usually tell people it's almost like a ladder, like stairs that we could go up on the level of where we want to go with intervention. So especially when people's function is being impacted, simple things to do are physical therapy, which can be a really great resource to help with things like balance, increasing your strength. There's also specific hand therapy called occupational therapy. That can be very useful for symptoms in the hands or having difficulty with things like buttoning. When people are having a lot of painful symptoms, when I'm going up that ladder talking to them, if people are not interested in taking any medicine by mouth, there are topical creams or components. So I mentioned, a more natural one is called capsaicin. There's definitely other creams that can be useful that are more medicated, that have things like numbing agents and nerve medication in it, but you rub it in rather than taking it by mouth, so you're less likely to have any side effects. There's integrative modalities like acupuncture, exercise. During therapies, we have a lot of modalities that can help to, like I said before, desensitize the area. And then there is always the medication option. So typical medications we use are neuropathic pain medications.
Very helpful information. And it's nice to know that there's lots of options, lots of things to try.
There's lots of options, and definitely the first time that I'm talking to and evaluating a patient, we kind of just go through all those options, and it's really, we discuss together, where do you want to start with this? And then that we have lots of other things to try.
That's nice, and that gives us hope, right? So we really try to be hopeful that there are some solutions that we can try. Yeah, that's great.
I think it's always important to be very hopeful. And I always tell people, nerves do regrow, they repair. It takes time, but it's possible. The body does heal itself, right? And so we're doing things that are helping to promote that healing and to help you through that process.
Very true. Good reminder. Absolutely. Let me see here. So one of the things that we like to do as an organization and educating our community of survivors is really empowering them with the information and questions that they should be asking their physicians so that they can write those down and take those into their office visits with them. So are there any specific questions that you think someone should have on their arsenal or on their notebook that they should ask if they are just beginning treatment, maybe that they should be talking to their doctor about in hopefully not looking forward to neuropathy, but planning and preparing for that?
Sure, yeah. So I always think it's really important before you begin any regimen to really understand exactly, what the regimen's going to be and the potential side effects. A lot of the oncologists that I work with, I know are great at that, and they do chemo education even before you begin. It's really important to have that discussion of what are the potential things that may happen during this treatment, and then what are the options I have if that does happen. Because I think when you already are prepared, it can be very helpful for when or if that time comes to know what your options are. So you've already kind of thought about it, and you've already been able to educate yourself on it.
Yeah, those are two really great questions. Thank you. It's always good to be prepared. So another question is, and this I've dealt with personally, but what about those who have tried everything? They've tried everything under the sun, everything under the moon. I know several people who are struggling with this right now who have tried literally everything. I guess the question here is, what advice or what recommendation would you have for those individuals coping with this? As you know, we know it can be very debilitating and
Exactly. It can be very debilitating. It can be very challenging.
physically and mentally. Yeah.
Physically and mentally, exactly.
Yeah.
So one, I think, finding support groups and people who are going through similar things is really important. I know that there's a very strong community for this, and so I think it's great to have
Good.
that outreach. I personally, in my practice, work with a psychology group, like an oncologic psychology group. So psychologists who are used to people who are going through and managing and dealing with cancer. And so I always think that that's an important component to address as well. Certainly when we're dealing with pain and with symptoms, there are cognitive and adaptive strategies that we can use to help us cope with that. And so I think that that's really important for treatment and something that shouldn't be forgotten or ignored.
Yeah. So I would encourage those that are watching that are dealing with this and have tried lots of things to remember what you just mentioned, asking their physicians about some of those adaptive strategies, those cognitive strategies, and then seeking out support groups. If there is specific neuropathy support groups out there that you know of, let us know. But just, at least mentioning that to their physician, I think that's good.
Yep.
Yeah, because it is real. It's real.
Very real, and it definitely can be very challenging.
Yes, absolutely. The last question that we have, in our time together before we go to some of the questions that have come in from the audience, and we've had quite a few, are there any resources, whether it's a reading or a support group, that you might suggest for anyone to learn more about neuropathy, or that might be helpful to them?
Yeah, the American Cancer Society actually has a very good resources on their webpage. Not only related to what questions or things that you should be asking related to peripheral neuropathy, but also management strategies. So that's definitely a good resource for people.
Great. Good. Thank you. All right. Well, thank you so much. We're going to go ahead and move into some of the questions that have come in from the audience. And one of those is, let's see here. I've been prescribed several medications for neuropathy, but none have worked so far. And I know that this, as we just talked about, may resonate with a lot of people watching. And I think maybe you actually just answered this question. She's asking what would the next step be? And I think that we did just cover that with some of your suggestions.
Sure. And, if oral medications are not working for you, then sometimes it is reasonable to look at other integrative modalities, things like acupuncture, looking at how are you functioning. Exercise can actually be very helpful for these symptoms. So how are you incorporating that? So I think that sometimes medicine by mouth is just not the only answer. There are other things to try.
Great. You just mentioned exercise, and one of the questions that came in was, is it true that inactivity can make neuropathy worse and that increased physical activity can help? So that was a question that came in. I think you just answered that.
Yeah, so I wouldn't say necessarily it could make it worse, but exercise can, and more studies are coming out about how important exercise is in cancer treatment in general, to help you through that chemotherapy. And so, yes, I definitely always encourage my patients, and I definitely want to speak to them about, well, what is your activity level and what goals can we set to get you to that? A lot of times, the exercise doesn't have to be so intensive. You don't have to be intimidated when someone tells you to exercise. Just things like brisk walking can be really helpful. Whenever I'm telling my patients or educating them about exercise and what level of intensity, you just need to get to a level where you're getting a light sweat. You start that first glisten, right? That's kind of the level of intensity that you want to get to. And it's all about building. You don't have to start at 100%, right? It's all about building, and that can be very helpful. A lot of times, patients may have concerns about, activity, especially when they're going through chemotherapy. Mm-hmm. And, the answer to that is it's absolutely okay to do. And almost, I encourage my patients to do it. You just have to have someone monitoring you. So monitoring, if you're having any changes in your counts or anything like that of that nature? Do you need any precautions? And that's why it's very helpful to have a rehabilitation professional on your oncology team. But absolutely, exercise can be great.
And sometimes I know for myself, I have to reframe thinking exercise versus just move your body. Just get some movement, because sometimes that term exercise is too hard.
Yeah, move your body, exactly. And you know, I know COVID has made these things challenging, but you know, having those kind of support groups and exercise groups can be really helpful through that whole process. And certainly when we can all be together safely, again, those are great things and resources to have.
Yeah. Many in the chat here today are bringing up the idea of soaking hands and feet in ice as a strategy to help with neuropathy. What would you say about that?
So that typically comes up a lot when people are actually going through chemotherapy treatment. So that it's still under investigation.
Yes.
Whether it can prevent neuropathy during chemotherapy, it's still under investigation. That's definitely a good thing to talk to your oncologist about if they're okay with you doing that. It's called cryotherapy, essentially. And if that is something that your oncologist is okay with doing, I think it's something to pursue if you're interested in that. But definitely still under investigation.
Good to know. Let me see here. Well, there is a question. If you can speak to this, what negative side effects might someone worry about with other prescription medications? I'm not sure the context of that question, maybe.
So I guess I think a lot of times the prescription medication we would use are what we call neuropathic pain medications. Talking very broadly, biggest side effects, biggest side effects that you may see with those are increased tiredness, fatigue. That's typically what I'm seeing as a big side effect. I think it's really important to have a good discussion with your clinician about, you know, every time before I started medicine, I always talk to patients about potential side effects. And certainly, you want to start low with these things. There's no rush. We don't have to start on super high doses. We can really take our time and just adjust and increase and elevate as is needed for you.
Great. We have a question about when we talked about finding a specialty physician that treats neuropathy. One person is asking, is there a certain way to find a doctor in your specialty, and particularly through insurance possibly? Or does insurance usually cover your specialty?
Yeah, so insurance typically does. So my main specialty is physical medicine rehabilitation, PM&R. In general, PM&R physician.
Can you repeat that again?
All right, yes. Physical medicine and rehabilitation. And if we shorten it, PM&R. And so typically PM&R physicians are pretty well trained in diagnosing and treating neuropathy symptoms. And then I specifically had further fellowship training, it's called, in cancer rehabilitation. So specifically in patients who are undergoing cancer treatments. And so you can just Google up cancer rehab, see if there's someone near you who's doing it. A lot of major institutions now it's definitely a growing field, but a lot of major institutions now are having cancer rehabilitation programs.
Oh, good. That's good to know. That's good to know. Here's a really great question specifically for someone experiencing neuropathy during the evening. So their question is, for nighttime neuropathy, pins and needles, those types of things in their feet are painful when they wear socks or when their sheets touch their legs or feet, which I can understand. Is there anything that you might suggest to help with that type of sensation?
Yes, so that is a very common complaint that I hear people say about, and specifically it's because at night, it's when you can be very aware of these symptoms, right? You're just laying there, there's not other things going on, you can be very aware of those symptoms. And I do hear that very commonly, that just even a sheet can be very uncomfortable. And so that is a great time to either have either that neuropathic pain medicine and you just take it at night. You don't have to take it during the day if you're fine during the day. Also, those topical creams I was talking about can be great because they can really help to almost numb the area a little bit before you go to bed. And so you just apply that before you go to bed. And so you're not feeling those sheets as much.
Oh, thank you. Thanks for addressing that. We have another question. We've got a few more minutes here. We're doing really good with questions. Um, I found that using a TENS machine on my feet has helped a bit. Do you know if there is any research on using a TENS machine for helping with neuropathy? And you might explain what a TENS machine is to those who don't
Sure.
know.
So a TENS machine, essentially, it's kind of pads hooked up to an electric box that you would put around the area that bothers you. And it basically, when you put it on it, it essentially alters the sensation in the region. And so we will sometimes use that in our therapies because that is, again, one of those modalities that we call that helps to desensitize the area. There is not strong research currently, to my knowledge, of its benefit, but it's still something that we try. It's risk benefit. The risk is relatively low in the right hands, right?
Yeah.
And so it's something that we try. There is another therapy that's similar to that but different, called scrambler therapy. And there's more and more research related to that scrambler therapy. Most sites, it's not easily come by as much as a TENS. Most rehabilitation sites will have a TENS. Not everyone has this scrambler therapy, but certainly the TENS is an option to try if you think it's helpful. It's very reasonable to use.
Okay. All right. And you said scrambler, like scrambling eggs, right?
Scrambler therapy. Yes. So it's definitely that. Also, research is still being done on it, but it's something that's definitely under investigation right now.
Okay.
And helpful for these symptoms potentially.
Great. Two more questions. Thank you for hanging in there with us.
Yeah,
and I want to ask this one because it's come up quite a few times. Some are asking why neuropathy might last longer for some patients and not long for others. Do you have any rationale to give us for that one?
So one, everyone is unique and individual, right? We are all different. And so that may be. The other thing is it depends really what type of chemotherapy you are
treatment,
getting, type of treatment, the amount of dosage. The interesting thing, some chemotherapies, you get the chemotherapy and you start getting neuropathy symptoms right away. But there's also a different chemotherapy that you can receive. And actually, it's not uncommon for those symptoms to happen weeks or months after you even finish chemotherapy.
Oh, right.
And so it really just depends on what you got. How did you have any risk factors before you began any of this? That can really affect how long this may impact you for.
Great. Yeah, that makes sense. Let's do two more here. How about that? Okay. So are there any suggestions, and this one's been asked a few times as well, for restless leg and foot cramping at night? Does that have anything to do with neuropathy?
So if you're having, you can have neuropathy that is presenting like symptoms like that. Again, if it's not a clear diagnosis, then sometimes having that neurology evaluation, actually having a nerve conduction test might be helpful to further just shed more light on the situation. And again, sometimes using those nerve pain agents can be helpful, that we would typically use in neuropathy, can be helpful for that.
Great. Awesome. And the last one I want to ask here, let me just make sure, because some of these that are coming in are the same questions. Someone did ask about L-glutamine for neuropathy. Can you speak to that at all? Is that something that's recommended for neuropathy?
So there is no official guideline that would recommend that currently, to my knowledge. But again, those are things that can be worth a try in discussing with your physician. If they don't think it's going to be harmful for you, then it can be worth a try.
Definitely discussing with your physician.
Yes.
Good. Well, this has been a wealth of information. I know this 30 minutes went by pretty quickly. I thank you all so much for your questions. Thank you, Dr. Martone, for being with us today and really kind of talking about this heavy topic, but important topic. And I think that you've shed a lot of light on the topic, given hope. There's lots of options, lots of great questions to come away with, to ask your physicians. Really great information. Yeah.
No,
so thank you so much for being with us today. Is there anything else you want to say?
Just really a pleasure to be with all of you today. I hope that you got something out of this. And that is kind of the theme that I want, the message I want everyone to take away is there's lots of things that we can try. There's
Yeah.
lots of resources that you have. So doing things like this and really educating yourself is a great way to help with all of this.
Absolutely. You've been a pleasure. Thank you. And just as a reminder to everyone, we'll be here again the same time next month with our Ask the Expert session. And until then, thank you very much and have a good day.